virus. Joining us tonight, Congresswoman Mariannette Miller-Meeks. Want to get your thoughts on this because we're in a pandemic for 2 years now, and it's pretty clear that it came from China. It's also very likely that it came out of that lab. Your thoughts on trying to silence that information from coming out?
Well, thank you very much for having me on, and I certainly think that the evidence shows predominantly that the virus emerged from the Wuhan Institute of Virology in Wuhan. As a member of the Select Subcommittee on the Coronavirus Task Force, we have been pushing for a full investigation into the origins of COVID-19, and we know that the FBI investigation was really just going over the same documents. And if you recall, Senator Tom Cotton posited this, and then the New York Times staff wanted to have him censored over suggesting that the virus emanated from the lab. So certainly both political and non-political figures have been silenced. They have been encouraged to stay silent. They've had information removed when it's been posted on the internet. And it's a huge problem because we need to know the origins of the virus. We need to know if there were lab safety protocols that were breached, if they were doing inappropriate gain-of-function research, and the international community should have a voice in this.
I think you're right. I think every person that's been impacted by this across the country wants to know where it came from, how we could prevent something like this happening in the future. If we don't investigate it, we'll never get to the bottom of it. And then, of course, you have those exchanges between Dr. Rand Paul and Dr. Fauci talking about gain-of-function research. Fauci basically saying it was so small, it's just not a big deal. Well, those are U.S. taxpayer dollars. And if they are indeed supporting gain-of-function research, we have every right to know about it.
Exactly. We have a right to know if the U.S. is funding, even if it's small dollars, gain-of-function research, which was prohibited in the United States. You know, there are ethics that are involved in this matter. Lab safety protocol we need to know about. Disclosure, there's immediate disclosure, and this is something that's not only important to the United States, it's important to every nation and to the World Health Organization to get to the bottom of where this virus originated and to make sure it doesn't happen again.
I mean, this virus wreaked havoc across the world, and it almost crippled major economies. And so you would think that there need to be consequences or an investigation. It's something that, you know, we'll continue to have a conversation about. But I want to broaden out a little bit as well to what we're seeing here in the United States, because it's like a 2-year pandemic going into year 3 right now. And it seems that this administration wants to prolong it with the mandates, with all the restrictions, with everything that we're seeing. People are tired. Their mental health is suffering as a result of this. And we're never going to get our economy back on track unless we open in earnest. Your thoughts?
Well, you know, Iowa's a prime example of that. Our governor worked with our public health officials and opened up our economy, opened up our schools last year. And as a result of that, we've had one of the most resilient economies and budgets in the entire United States. So it's not only that people are tired, but we know now that the vaccine doesn't prevent transmission. So it doesn't prevent transmission of the Delta variant, and it has an even worse record in preventing transmission of the Omicron variant, especially about a month after vaccination. So you're not going to be boosting people every month in order to try to prevent transmission. The vaccines are great for preventing serious illness, hospitalization, and death, and that's worthwhile to talk about. But we need to move on. I think all of us know that this is a virus that we're going to have to live with, that there are going to be variations, and that people can opt to wear a mask. They can opt to get boosted. They can not gather in large groups. So we ourselves can take responsibility, but I think it's time for the government to have a step back, give us the tools and information we need, and let us make those decisions for ourselves.
Congresswoman, thank you so much for your time, your insight. We will continue to have this conversation with you. It is so very important.